McCormack Innovation we're based in Scotland. We were set up about 3 years ago by my uncle, my dad and I, and we have been working towards providing our offerings to the NHS and others really. We specialise in products that are soluble, will dissolve in water. What we want to see is our products put into the respective sectors to solve issues that are related to anything from compliance in cancer colorectal screening processes, or like with our wipe, for example, we would want to try and reduce the damage done to sewage and drainage by having a wipe that dissolves as well. Well, we've got 2 of our products. We've got probably a list of about 4 products, maybe 5 products. Not all of them are currently market ready, but the 2 that are indeed are here this morning. We've got a stool collector for digestive screening. We hope to send that in the post, or indeed for a private offering for self-diagnostics. But what we want to do is assist with compliance to those sort of tests. The other product that we've got is a dissolvable wet wipe in the medical sector, so alcohol wipes, sterile wipes, or indeed adhesive removal wipes like the ones I've brought today for stoma bags and things like that. I've just been speaking to delegates really about trying to get this offering into the NHS, trying to get clinical evidence for the stool collector. That's obviously something that we're going to have to do. It's going to be a big challenge for us to illustrate the evidence that we are confident that we have. I mean, I've had conversations with clinicians about our products and they are very, very promising. But what we do not have at the moment is solid clinical evidence, clinical effectiveness, and that's what we're needing. We could do with some support and guidance in that regard, actually, being a small startup. Yeah, I think we've got a product, it's a soluble secondary wound dressing. It's currently in the research and development stage. We, being a startup, have got funding issues with that, so we've concentrated on trying to get our other products that are market ready out there and to get some revenue for then the research needed. Because this one, it's particularly close to me, I think. It gets me emotive. The effect would be quite clear. It would be for people who've got very, very severe burns, people who've got EB, sometimes sort of colloquially known as butterfly skin. So what we would hope to do is improve their quality of life quite quickly by reducing the time that it would take to dress and redress, and then increasing sort of the effectiveness of some of those primary dressings as well. Not that we would make them. My personal thoughts, it's been quite good. It's been a great chance to get a series of people with vested interests. I spent the last week at Arab Health in the Emirates, which is a much, much larger sort of outing. But it's a different experience, I suppose, because there are so many people and it's so hectic. It's quite difficult to try and sift through decent leads. It's quite difficult to try and get some of that business generated in that way. But here, with a captive audience, everyone obviously has paid a much higher price to get in, and so those that are not messing around. They are either the clinical stakeholder that I wanted to speak to, or they have proximity to that individual. So it's actually been very, very handy.